Well, hello and welcome to all of our viewers around the world. I'm Fiona Langsharp, IBCLC Director of Communications and MC here at Gold Learning. Well, we are getting very excited over here as we get ready for our Gold Lactation Online Conference 2024. And what that means is we have so much content to cover, and we'll also be taking a little bit of a deep dive into some necessary topics that you asked us for, which is why I'm here today with Tori Hamilton. Thank you so much, Tori, for joining me here today.
Oh, thank you for having me.
Yeah, what a good topic. Now, full disclaimer, I just heard your presentation. It's pre-recorded. It'll be ready to go as soon as people register and we open up the conference, which is really exciting. And we are talking about management of mental health assessment during a lactation consult. So, Tori, it just everyone that's listening in who's ever sat with a new parent, we know what the struggles look like, and sometimes we feel like we are on the front lines. We're the first people that they've started to unravel with as those parents. So tell me, what is the significance that we are doing assessments in that moment and providing that sort of foundation to that client to find out what's going on?
That's a great question. So it's so important for us as lactation consultants to be able to hold that space for the client and to be able to allow them to share those vulnerable moments with us, which we so commonly get to experience. And not only with breastfeeding, but also with the client's mental health and well-being in general. So just seeing our clients as whole people who are experiencing a tremendous amount of stress often, and
Mm-hmm.
how that can impact them in their journeyhood into becoming parents, as well as throughout their lives. So when we're able to offer them that kindness and compassion and support and provide them with resources and do assessments so that they know how they can best be supported, then they don't have to continue feeling the way that they're feeling.
Yeah, no, absolutely. Now, as you're talking, I'm thinking about all the families that I've seen over the years, Tori. And honestly, I've always said that, it really could be we go in for one thing. We go in and we've been asked to fix the latch. Okay, so I just break it down really simply. But I always say, often it's never about the latch. When it comes down to it, often it can be these barriers. It can be that moment in time where they've just reached that point of almost despair. And it doesn't mean that they are, that right away that it's a 911 call or anything like this. It can be just that they need someone to express how they're feeling to. But the assessment part, I heard you talk about that in your presentation, and I thought to myself, you know what? There's no way for me to really know, and perhaps it's really important that I do have a little bit of a guide in order to help me. How important is it to, sitting down with the assessments that you mentioned? You talked about the GAD, which is the generalized anxiety disorder, and then you talked about the Edinburgh postnatal depression as well. And many people are familiar with those tools, at least one of them anyways. Important to have on hand, be familiar with. What do you think?
Definitely. So, especially when we're starting off with staying present for perinatal mental health challenges, because
Mm-hmm.
at first it can feel like a bit out of our wheelhouse. So having these screening tools can provide some confidence for the IBCLCs in knowing that they're touching on all the different boxes, and they also know, okay, so if it's at this level, then this is kind of what I should be looking at next for the client, so that we don't end up having clients that end up going through the cracks and not receiving the support that they need.
Yeah, and that's so important. Yeah, those gaps in care or those cracks in care are really what we're looking at, nationally and internationally right now.
Mhm.
So many families are not getting to the people soon enough in that postnatal period because they're suffering unnecessarily. And this is something that you have seen in your practice, right?
Yes, very commonly, because oftentimes the screening isn't being done. in general, or it's only
Mm,
being done in pregnancy and only in it within a 15-minute checkup, so that it
sure.
doesn't create a lot of space to actually hear what the client has been going through, what their concerns are, and then there's no check-in during the birth experience or the postpartum experience.
Mm,
So that 6-week check-in is often not very comprehensive and doesn't offer a lot of guidance or support to those clients.
mm. Yeah, I can see how valuable, being a lactation consultant it is now to really have that, understanding and knowledge on how to, to present these tools for our families. Now, in your presentation, I love the fact that you took us through this sort of step-by-step guide, very simply but very profoundly. That's how I took it today, in really how to build upon not only, I can still do my consult and so forth and so on, but really making sure that I'm supporting that family and then advocating for them, and referring them. So it's going to be important as a lactation specialist or an IBCLC to really know the resources beyond myself in my community, so that I can refer and or send them back to their GP, our family doctor, whoever that they have been with before, right, Tori?
Definitely. I highly recommend creating a resource list that you can
Mm-hmm.
provide every client and include all sorts of different comprehensive care, including mental health.
Yeah, no, absolutely. I can see how valuable that is. Now,
Mhm.
you have lots of experience in this area. I know as a professional, you're a registered nurse, a psychotherapist, and you're seeing a lot of clients now online. What has changed for you over the last few years? You're also a very busy mom as well. But tell me, you're able to see clients remotely. Are they responding well to this as well, Tori?
Yeah, the biggest thing is that therapist client relationship um, to be fostered, and connection doesn't need to be in person necessarily, as long as the
Mm-hmm.
client feels safe in their environment while they're on the call. So that is definitely a part of it, as well as making sure that they feel comfortable with the relationship between therapist and client.
Yeah, I really appreciate that because you're really the next stop that someone could refer to potentially in their local area. And I do recall as part of becoming an IBCLC is that one of the requirements is to have that resource list. It's such an important value, to our clients to make sure that it goes beyond just seeing us. We know that it's such a bigger picture. Tori, is there anything else that, having the experience that you have and now seeing these clients, what would you share with folks as one of the most invaluable things that they should do or be aware of, when they're working with families today?
Yeah, the biggest piece for me is to be able to normalize the stress response that can often follow
Mm,
having a birth and a postpartum experience, and allowing that client space to share their journey and their experience with us so that they don't feel alone. Because when clients feel alone, then there's no hope for the future. And there can be a lot of guilt and shame connected with their experiences. So just by being present and attuned to your clients can be deeply healing for them.
Oh, I love that so much. That reminds me a lot. We talked recently a lot about mental health. It certainly seems like, there's more conversation about it, so that it does feel like there's, folks understanding and having the awareness. Now I feel like we really need to put that into practice. So words are really good, but what is the actionable item behind it? So I think we can definitely challenge those who are listening in today, to look at the resources. They can attend your presentation, of course, and the mental health add-on package here at Gold Lactation. I really appreciate, how really you took us on that journey today or took me on that journey through that presentation today. But those listening in, you'll have an opportunity to come and listen to Tori as part of of course, our Gold Lactation Conference. Thank you for giving me the awareness, and so many others I know that will really benefit, is just again to be attuned. Remember, what families have gone through. It could be way bigger than what we know or understand in that moment, and to really just continue to meet them where they're at. Thank you so much once again, Tori, for being with us here today. It's been fabulous hosting this session.
And thanks for having me.
Yeah. Well, we'll look forward to, of course, connecting with you again. Tori will be here as part of our Gold Lactation Conference. You can find out all the details on the website right now at goldlactation.com. You'll be able to connect with Tori in the forums during the live event as well. If you have any questions, or perhaps you can share what your practice is like and get some suggestions on how to grow that as well, and make sure that your clients are getting the resources that they need as part of their mental health as well. Thank you again for being here today, and we'll look forward to seeing you all again. Bye-bye for now, everyone.